from the pharmacy. As a pharmacy, you have to make sure that you give the right information for the patients. Maybe they don't know that is it right or not because they believe they're pharmacy. So it's the pharmacist's role, the pharmacist's major role to give the right information. It's your responsibilities as pharmacy students to study hard, to really give your best in study and practice, so you will become a good pharmacist. You will become a wise pharmacist and give good integrity in your work. Hope it answers your question. Or you maybe ask the other pharmacy is like the second and third alternative.
Thank you, ma'am.
Thank you, Madam Hardianti Sharif. So for the next question, you can put the question in the chat or open your mic just like our friend did.
If I may add a little bit to Ms. Hardianti answer now. Okay. I would agree for whatever that Ms. Hardianti just mentioned. So I would like to add on, if you're a pharmacist, we know that patient counseling is very important, right? I've encountered a patient with the same case as inhaler. She after we counseled the right way to take the inhaler, after a month, her asthma actually exacerbated. And we asked again what went wrong. And she said that she has been doing the right way in taking the inhaler. And we asked her to demonstrate. And can you guess what she did for the whole month? She has been blowing into the inhaler instead of inhaling, right? We know that the technique is a bit difficult. So as a pharmacist, I just want to add that we can do employ teach back method. Yeah. So after we teach them, we ask them to teach us back. So that's the one of the ways that we can know whether they really understood or not. And as a patient, some of us, we are patient, right? And we don't know. Sometimes we trust our pharmacists so much. We trust our doctors. But if there is somehow, what do you call that? Suspicious, you look at the label, for example, the label looks very suspicious. You have been taking paracetamol, let's say, for 1 gram, right? 1 gram QDM for fever. And then suddenly you get 2 gram or 4 gram, which is a maximum dose. Obviously, you as a patient, you have to have high medicine literacy. And this is, I think, the efforts that we as a pharmacist, we have to educate our population that they have to know about their medication, not just as the pharmacists or the healthcare professionals, because we do a lot of mistakes too, right? So patient has to have a very good medicine literacy. They have to know that they have to have the, suspicion. We call that suspicion. And straight away ask their pharmacist if they have any pertanyaan ataupun keraguan berkenaan ubat yang mereka ambil. Okay, so this is why we have to educate our patient to not be shy, because we are shy, right? Malaysian, we are shy to ask. So yeah, I just want to add on that. Thank you.
Thank you, Madam Sabiha, for the clarification and for the add-on points. So if you guys have any more questions, just like I said, you can just write into the chat section, and just open your mind and ask directly. Maybe one last question before we end our webinar.
For that, maybe I want to give information. In Indonesia, we also don't have pharmacist independent prescriber like in Malaysia. So we still just like discussion with the doctor and with our advice like that and so on. Thank you.
Just to clarify, we in Malaysia, we don't have yet as well independent prescriber. It's only, I think it's quite a bit of a challenge because we don't have dispensing separation here in Malaysia because the doctors do all the prescribing and dispensing at their own clinics, right? So it's a little bit hard to implement prescribing pharmacies here, but we hope that we are moving towards that in the future, inshallah.
What about the dispensing? The dispensing also doing by the doctors?
Yeah, in here in Malaysia, we have the clinics, right? The GP, general practitioner clinic, so they can dispense their own medication. And especially they would do that because the patient get the prescription right straight away, and then when they want to go out from the clinics, they would get the medication dispensed from the same facility. Unless if the patient really need emergency drugs, they can just go to the community pharmacist to get the medication. Again, that is only for OTCs, not the poison drugs, because still they have to get the prescription from the doctor and bring along the prescription to the pharmacies, community pharmacies.
So in Indonesia, if we have a certificate or if we are a pharmacist, we could dispensing the drugs like the administer or for special drugs like toxic drugs. We have a handling room to administer the drugs. So if you are a pharmacist with certificate or license, you may doing the dispensing. Not only in the big hospitals, also in the region. If the room is sterile and, for example, is clean, and you have a license for that, you are a pharmacist with license, you may doing this dispensing.
Any more questions from the participants?
Maybe one last question from the participants.
Yeah.
You can just ask directly or put it in the Q&A chat section. Maybe one question from me, as I can representing the participant. This is a question for Madam Sabiha. So we know that the emerging trends in telepharmacy and digital health. So how are Malaysian pharmacists adapting to the growing field of digital health and telepharmacy? You know that people or patients in Malaysia, they are really not into this, and sometimes they have lack of knowledge about this, and how these pharmacists want to put in effort to adapt and adopt this kind of field.
That's actually a very good question. Hard one for me. No, I'm just kidding, Akmal. Yes, we know telepharmacy, it can be a pro and cons at the same time, right? Because not everyone has the access to the internet. And I think this movement by using telepharmacy has been at around 1 to 2 years, right? Just after the pandemic start. And not everyone knows about telepharmacy, I believe. And actually, there are studies as well being done by our researchers here in UiTM. And they found out that the public, they don't know much about telepharmacy, which is actually a shame, because we have the service, but the public don't know it. Then how can we give the service to others? So I think everyone is trying to promote new service despite of the challenge, and it has to be from all of us, including all of you, the students and so on, because they don't know, the public don't know about it. So I believe community pharmacies, they are giving their best effort rather than the pharmacists in academics or in industry. And most of the hospital pharmacists as well, they are promoting the telepharmacy service to their patient, especially those who have trouble to access to the facilities. Those in the Sabah, Sarawak, they cannot go. They have to travel sometimes by the river, by using the perahu, to get to the health facilities. So hospital pharmacists, they are doing their role. They are advocating about the existence of this service to the public. It's a continuous effort, actually.
Thank you, Madam Sabiha, for the wonderful.
I hope I answer your question, Akmal.
Yeah, it is very helpful for me.
Thank you.
So, I think we've already hit 12 p.m. So as we come to the end of this webinar, I want to thank all of our speakers for their time and insights. And of course, thank you to all of our attendees for joining us today. We hope you found the session valuable and inspiring. If you have any further questions or would like to follow up on today's topics, please don't hesitate to reach out to us. So thank you again for being with us today, and have a great day, anyone. So I'm Akmal Haziq, and see you in the other time, everyone.
Okay, thank you very much. Should we take one picture?
Yeah, we should.
Yeah.
We have to documenting our meeting today.
Yeah.
So everyone, please open up your camera. We're gonna do our photography session.
Today we're going to be creating a flat design video matter things, and once I have a little bit
So in the count of 3, 1, 2.
Let's create this handle inside, and we'll go click and drag to sort of create a little shape, and then we'll just bring it right back down.
1, 2, 3. Okay, last one, freestyle. 1, 2, 3. Okay, thank you. Don't forget to fill the attendance form in the chat. That's all for today. Thank you, everyone.
Thank you,
Thank
everyone.
you.
Assalamualaikum warahmatullahi
You
wabarakatuh.
too. Thank you. See you again.